Make America Healthy Again. This video is based on key insights from the book Make America Healthy Again by Nicole Saphier. Introduction. America is facing a healthcare crisis, with rising costs and a decline in life expectancy. Nicole Saphier notes that this crisis is not just about the cost of medical care, but also about the behavior of individuals and the role of government in the healthcare system. The data shows that the average life expectancy in the United States has been declining since 2015, with people dying earlier due to various factors such as lifestyle choices and a broken healthcare system. The healthcare system in the United States is a complex issue, with many factors contributing to its high costs. Nicole Saphier points out that the cost of pharmaceuticals and medical devices is only a small part of the problem, accounting for approximately 4% of the increased healthcare cost each year. The main driver of the rising costs is the administrative staff, legal counselors, information and technology specialists, marketing personnel, and ancillary staff that are required to run the healthcare system. This organizational compound adds remarkable non-medical expenses to the total cost of care, increasing healthcare spending. The acquisition of drug rights is another area where corporate greed is evident. Small companies buy the marketing rights to medications and then increase the price for profit, without having to bear the burden of significant research and development debt. For example, the price of EpiPen, a life-saving medicine used to treat severe allergic reactions, has increased from approximately $57 to $415 for a pack of 2 EpiPens since Mylan Pharmaceuticals acquired the product's marketing rights in 2007. This kind of price gouging is not only unfair to patients, but also raises questions about moral ethics and fair practice regarding drug acquisitions and pricing. The role of government in the healthcare crisis is also significant. Nicole Saphier notes that each presidential administration has recognized the need for healthcare reform, but the problem persists. The data shows that the cost of healthcare is projected to reach 20% of the gross domestic product by 2027, with the Centers for Medicare and Medicaid Services publishing a report that includes colorful charts demonstrating theories on how and why costs have risen. However, the report and various media outlets failed to note that the problem is not a new one, but rather a growing issue that has been developing over several decades. The healthcare system in the United States is a business venture, with corporate executives and high-level administrators earning high salaries. Nicole Saphier points out that the highest-paid entities in healthcare are not physicians, but rather corporate executives and administrators. For example, the CEO of Aetna made $18.7 million in total compensation in 2016, while the average salary of a general physician ranges from $150,000 to $180,000. This disparity in salaries is a reflection of the corporate norm, where CEO salary growth has far outpaced overall wage growth over the past several decades. Nicole Saphier argues that the key to reducing healthcare costs is to reduce the number of Americans who are sick. According to the CDC, preventable chronic diseases account for 75% of the nation's healthcare spending. American healthcare costs as much as it does because of the lifestyle choices of individuals, such as poor diet and lack of exercise. The critical concentration should therefore be on how individuals can make healthy choices and take preventative measures to avoid costly illness. The book Make America Healthy Again explores the twin problems that have stirred the healthcare crisis. The first problem is the inaccurate picture of the nation's health that is portrayed in the media, with people thinking that the whole nation is healthy and looking for ways to get healthier. The second problem is that the plan to fix the healthcare crisis has made it worse, with people relying on experts to solve their problems with pills and surgeries rather than taking responsibility for their own health. Nicole Saphier argues that the power to regain functional control of the health system is not gone, but rather it is time to refocus on how individuals and collectively can be less sick. The opioid epidemic, diabetes, doctor burnout, and the $1 trillion spent on cancer every year are just a few examples of the many issues that are plaguing the healthcare system. Nicole Saphier contends that these problems are not just medical issues, but also societal issues that require a comprehensive approach. The solution to the healthcare crisis lies in a combination of individual responsibility, government policy, and a shift in the way the healthcare system is structured. By understanding the complex factors that contribute to the crisis, it is possible to develop effective solutions that will make America a healthier nation. Chapter 1: The American Health Crisis. Nicole Saphier emphasizes that the healthcare crisis in America is largely a result of bad behavior and government intervention. According to data, the average American consumes 3,600 calories per day, far exceeding the recommended daily intake. This overconsumption is a major contributor to the rising rates of obesity, diabetes, and heart disease. Nicole Saphier points out that people often blame the food industry for their unhealthy diet, but the truth is that individuals have the power to make choices about what they eat. The fact that 90% of adults do not consume the recommended daily amounts of fruits and vegetables, despite claims of eating healthier, suggests that personal responsibility is lacking. The government's role in the healthcare crisis is also significant. Nicole Saphier explains that the government's exemption of employer-paid health insurance benefits from taxation created a tax advantage for group plans over individual policies. This led to a system where employers, rather than individuals, controlled healthcare decisions. As medical costs rose, employers began to restrict coverage, increase employee costs, and even drop health insurance benefits altogether. The data shows that since 2008, average family premiums have increased at a rapid pace, twice as fast as the rise in workers' earnings and 3 times as fast as inflation. Nicole Saphier also highlights the issue of instant gratification in America. The demand for quick fixes and instant results has led to an inflated sense of entitlement, with people wanting innovation to provide simple cures without putting in the effort to maintain their health. The rise of cosmetic procedures and fad diets is a testament to this phenomenon. According to the American Society of Plastic Surgeons, there were 17.7 million cosmetic procedures performed in 2018. This desire for instant gratification is also evident in the way people approach healthcare, with many seeking quick fixes rather than addressing the underlying causes of their health issues. Furthermore, Nicole Saphier argues that the government's approach to healthcare is flawed. The idea of a single-payer system, for example, may seem appealing, but it can lead to rationing of care and longer wait times. In Canada, for instance, the average wait time to see a specialist is 35 weeks, and it can take up to a year to get an MRI. Nicole Saphier notes that if the United States were to adopt a single-payer system, it would likely lead to similar problems, with Americans facing longer wait times and reduced access to quality care. The data on wait times in other countries with single-payer systems is alarming. In the United Kingdom, for example, 78.2% of patients start treatment within 2 months of being urgently referred by their primary care doctor. However, this wait time can have serious consequences, including increased pain and mental anguish and poorer medical outcomes. Nicole Saphier emphasizes that the United States should learn from these examples and avoid adopting a system that prioritizes universality over quality and accessibility. Ultimately, Nicole Saphier contends that the healthcare crisis in America is a result of a complex interplay between bad behavior and government intervention. By examining the data and evidence, it becomes clear that personal responsibility and individual choices play a significant role in determining health outcomes. Rather than relying on the government to fix the problem, Americans must take control of their own health and make informed decisions about their lifestyle and health care. As Nicole Saphier suggests, this requires a fundamental shift in the way people think about health care, from a focus on quick fixes and instant gratification to an emphasis on prevention, personal responsibility, and quality care. Chapter 2: Why is healthcare so expensive? Nicole Saphier notes that the American healthcare system has become a trillion-dollar crisis, and a significant factor contributing to this issue is bad behavior. The data shows that many health problems in the United States are caused by preventable factors such as smoking, excessive alcohol consumption, and poor diet. These behaviors lead to an increased risk of developing chronic diseases like heart disease, diabetes, and cancer, which are among the most expensive to treat. For instance, the economic toll of non-communicable diseases, including cancer, cardiovascular disease, and obesity-related illness, is estimated to reach $47 trillion globally by 2030. Nicole Saphier argues that government policies have also played a role in exacerbating the crisis. The introduction of Medicare and Medicaid in the 1960s, while well-intentioned, has led to a system where people are incentivized to rely on government-funded care rather than taking responsibility for their own health. As a result, there is a lack of transparency and accountability in the system, leading to waste and inefficiency. The data highlights that healthcare spending has increased dramatically, from 5% of GDP in 1960 to 17.9% in 2017, with projections showing it will continue to rise to 19.9% by 2025. The lack of personal responsibility and government oversight has created an environment where people are more likely to demand medical treatments for non-essential care, driving up prices. Nicole Saphier points out that the pharmaceutical industry takes advantage of this situation by developing and marketing medications for conditions that could be prevented through lifestyle changes. The system is driven by a money train of pharmaceutical companies, insurance companies, and hospitals, all of which profit from the increasing demand for medical treatments. The data shows that 4 out of every 5 deaths in the United States are attributed to non-communicable diseases, which could be prevented or managed through changes in diet, lifestyle, and environmental factors. Nicole Saphier also highlights the role of environmental factors, such as the prevalence of fast food and processed food, in contributing to the health crisis. The data shows that children are particularly vulnerable, with rising rates of obesity and type 2 diabetes. The CDC reports that 1 in 5 children has arthritis, largely linked to lifestyle and weight, and that 1 in 3 children born in 2000 will develop type 2 diabetes unless there are significant changes in diet and physical activity levels. Furthermore, Nicole Saphier notes that the fear of being labeled as fat-shaming or prejudiced has prevented open discussions about obesity and sedentariness. The American Academy of Pediatrics has recommended using neutral language when discussing weight issues, rather than terms like obese or fat. However, this approach has been criticized for avoiding the real issues and failing to address the root causes of the problem. The data shows that the stigma associated with being overweight can contribute to damaging behaviors, but it is also important to acknowledge the need for honest discussions about the health risks associated with obesity. In conclusion, Nicole Saphier argues that the trillion-dollar healthcare crisis in America is a result of a combination of bad behavior and government policies. The data shows that the lack of personal responsibility, the influence of the pharmaceutical industry, and the failure of government oversight have all contributed to the crisis. To address this issue, it is essential to promote transparency, accountability, and personal responsibility in the healthcare system, and to encourage individuals to take control of their own health by making informed lifestyle choices. Chapter 3: America, You're Breaking Our Heart. Cardiovascular disease is the leading cause of death in the United States, claiming millions of lives each year. Nicole Saphier notes that despite the known risks, many Americans remain complacent, unaware of the everyday culprits that increase their risk of disease. The data highlights the alarming rates of heart disease, with approximately 121 million American adults living with some form of cardiovascular disease. This crisis has been exacerbated by bad behavior, including poor diet, lack of exercise, and smoking, as well as government policies that have failed to effectively address the issue. The rise of processed foods and sugary drinks has been linked to an increased risk of heart disease, with the data showing that regular consumption of these products can lead to a buildup of plaque in blood vessels. Nicole Saphier explains that this can result in a range of health problems, including heart attacks, strokes, and kidney failure. Furthermore, the marketing efforts of big food and drink companies have contributed to the problem, with many products being labeled as healthy, when in fact they are high in salt, sugar, and unhealthy fats. The government has also played a role in the crisis, with policies that have failed to effectively regulate the food and drink industry. For example, the data shows that the average American's body mass index, BMI, has increased over the years, with approximately 14 out of every 100 adults in the United States still smoking cigarettes. Nicole Saphier argues that the government's failure to implement effective anti-smoking campaigns and regulations has contributed to the high rates of smoking-related illnesses. In addition to poor diet and smoking, lack of exercise is also a major contributor to the crisis. The data highlights the importance of regular physical activity, with Nicole Saphier noting that even small amounts of exercise can significantly reduce the risk of heart disease. However, many Americans fail to meet the recommended levels of physical activity, with the data showing that approximately 50% of prescriptions for heart medication are taken incorrectly or not taken at all. The financial burden of the crisis is staggering, with the data showing that the cost of smoking-related illnesses alone is as much as $170 billion annually. Nicole Saphier argues that the government's failure to hold individuals accountable for their health choices has contributed to the crisis, with many people relying on insurance companies to cover the costs of their medical care. The data highlights the need for a new approach, one that emphasizes prevention and accountability and encourages individuals to take control of their health. Nicole Saphier suggests that simple changes, such as maintaining a healthy weight, getting regular exercise, and avoiding smoking, can significantly reduce the risk of heart disease. The data shows that these changes can be made through a combination of individual effort and government support, with policies that promote healthy lifestyles and regulate the food and drink industry. By working together, it is possible to address the trillion-dollar crisis in America and improve the health and well-being of millions of people. The data provides a clear picture of the problem, and Nicole Saphier's analysis offers a roadmap for solutions, emphasizing the need for individual responsibility, government accountability, and a commitment to prevention. Chapter 4, The Big C, Cancer. Nicole Saphier explains that heart disease and cancer are the two leading causes of death in America, with cancer being the second most common cause of death. According to the National Cancer Institute, men and women have approximately a 39% chance of being diagnosed with cancer in their lifetimes. The data shows that in 2014, 22 states had more cancer deaths than heart disease deaths, which is a substantial increase from 2002, when only 2 states had more cancer deaths than heart disease deaths. Many cancers are preventable, and Nicole Saphier emphasizes that nearly half of all cancer diagnoses may be preventable. The American Cancer Society estimated that in 2019, there would be 1,660 deaths from cancer every day, and just over 600,000 deaths from cancer over the course of the year. 1/3 of all Americans are going to develop cancer at some point in their lifetime, with the most common type of cancer being non-melanoma skin cancer. The data highlights that cancer can form anywhere in the body, from head to toe, because the human body is made of trillions of cells. Nicole Saphier notes that our own genetic makeup may predispose us to form some cancers, but only 5 to 10% of all cancers are caused by inherited genetic mutations. The rest happen because of the damage we expose our bodies to throughout our lifetime. Normal aging is a fundamental factor, and the incidence of cancer rises dramatically with age, likely due to a lifetime buildup of physical, chemical, and biological carcinogenic exposure. The data shows that the overall risk accumulates, and as we age, our bodies lose the ability to repair themselves. The economic cost of cancer is substantial, with the United States spending $157 billion in cancer care in 2010, and this figure is projected to surpass $174 billion in 2020. The total annual economic cost of cancer through healthcare expenditure, plus loss of productivity, is approximately $1.2 trillion per year. Nicole Saphier argues that the high cost of cancer care is partly due to bad behavior, such as smoking, poor eating habits, excess alcohol consumption, and physical inactivity, which are controllable risk factors for cancer. The data highlights that at least 42% of cancers could have been prevented, with over a third of them being from smoking tobacco. Nicole Saphier also points out that government policies and the healthcare system have contributed to the crisis. The Affordable Care Act eliminated the cost-sharing requirement for several cancer screenings, but screening rates remain suboptimal, with Americans not meeting the guidelines for recommended screenings. The guidelines for mammograms and cervical cancer screenings were updated, but these updates required fewer screenings and at longer intervals, which may negatively affect younger women who tend to have more aggressive cancers. The data shows that insurance companies are resistant to covering state-of-the-art cancer screenings, which can detect cancer earlier and reduce costs. Nicole Saphier emphasizes that the key to reducing the economic burden of cancer is to focus on prevention and early detection. This can be achieved by promoting healthy behaviors, such as exercise, a balanced diet, and avoidance of tobacco and excessive alcohol consumption. The data highlights that a diet low in fruits and vegetables is another risk factor for cancer, and only 1 in 10 Americans meets the recommended levels of fruit and vegetable consumption. Phytochemicals, naturally occurring plant chemicals, can have positive effects on the chemical processes inside our bodies and help prevent cancer. Nicole Saphier argues that the government and healthcare system must take a more proactive approach to promoting prevention and early detection. This can be achieved by increasing access to cancer screenings, investing in health services and training for healthcare workers, and promoting public awareness of cancer symptoms and detection programs. The data shows that early detection can significantly improve survival rates and reduce treatment costs. For example, when breast cancer is detected with screening at an early stage, over 95% of women diagnosed will still be alive 5 years later, compared to only 15% of women diagnosed with the most advanced stage of disease. In conclusion, Nicole Saphier's work highlights that the trillion-dollar crisis in America caused by cancer is partly due to bad behavior and government policies. By promoting healthy behaviors, increasing access to cancer screenings, and investing in health services and training, the economic burden of cancer can be reduced and lives can be saved. The data emphasizes the importance of prevention and early detection in reducing the incidence and cost of cancer. And it is essential that individuals, the government, and the healthcare system work together to address this crisis. Chapter 5, Into the Deep. Nicole Saphier explains that America is facing a growing mental health crisis that is still not fully understood. Mental health conditions are undertreated in the country, largely due to the enduring stigma attached to mental illness. According to the National Institute of Mental Health, in 2017, only 42% of adults in the United States with a mental illness received mental health services. This stigma can lead to people keeping their mental health struggles private or failing to recognize them altogether. The data shows that approximately 1 in 5 adults in the United States experiences mental illness in any given year. Nicole Saphier notes that this is more common than other health issues, such as peanut allergies, which affect only 5% of Americans. However, despite its prevalence, mental health disorders are often subtle and can be overlooked. Anxiety disorders are the most common mental health issues and are on the rise, affecting just over 18% of the population. Half of all chronic mental illness begins by age 14 and 3/4 by age 24. Nicole Saphier argues that the country's financial burden is also affected by mental health problems. America loses over $193 billion in earnings per year to serious mental illness when people are unable to work. Furthermore, those with a mental health disorder also face an increased risk of concurrent chronic medical conditions, such as obesity and heart disease, which drive up the cost of care for untreated mental illness. The undertreatment of mental illness is also attributed to misdiagnosis. Mental health disorders are not black and white, and diagnoses can be difficult. A mental health diagnosis cannot be easily confirmed with a single test, and assessing a person for signs of mental illness requires particular expertise and finesse. The consequences of misdiagnosis can be severe, allowing anguish to grow unchecked and potentially leading to destructive behaviors. Nicole Saphier points out that government policies and societal pressures have contributed to the mental health crisis. The No Child Left Behind Act, for example, has led to kindergartners taking timed tests on reading and writing, instead of focusing on crafts, physical activity, and socialization skills. This pressure to succeed can lead to stress, inadequacy, apprehension, and depression in high-achieving students. The emphasis on standardized testing and the desire for children to attend top colleges have created a culture of competition, where children feel overwhelmed and anxious. The phenomenon of helicopter parents has also been linked to amplified stress and anxiety in children. Overparenting, especially of late teens, breeds narcissism and poor coping skills. Nicole Saphier suggests that parents should step back and allow children to thrive in their own way, rather than constantly intervening and pushing them to succeed. This could help lessen the risk of mental health disorders and suicide in young people. Nicole Saphier also highlights the impact of social media on mental health. The constant exposure to curated and manipulated images can lead to feelings of inadequacy and low self-esteem. The desire for perfection and the pressure to present a perfect online image can cause young people to modify their bodies and engage in harmful behaviors. The data shows that teens who spend more time on social media are more likely to describe themselves as having mental health issues. The economic cost of mental health disorders is staggering, with some estimates suggesting that it has reached $1 trillion crisis in America. Nicole Saphier argues that the government has a role to play in addressing this crisis. Mental health should be covered by insurance at the same level as physical health, and there should be more funding for mental health services and research. The Affordable Care Act was a step in the right direction, but more needs to be done to integrate mental health into the healthcare system. Overall, Nicole Saphier's work highlights the need for a comprehensive approach to addressing the mental health crisis in America. This includes reducing stigma, improving diagnosis and treatment, and addressing the societal and economic factors that contribute to mental health disorders. By working together, it is possible to create a future of mental and emotional well-being for all Americans. Chapter 6: The Opioid Crisis. The origins of the opioid crisis in America are complex and multifaceted, involving a combination of factors including overprescription of opioids, aggressive marketing by pharmaceutical companies, and inadequate government regulation. According to Nicole Saphier, the crisis has its roots in the 1990s, when pharmaceutical companies began to market opioids as a safe and effective treatment for chronic pain. This led to a significant increase in prescriptions, with many doctors unaware of the potential for addiction. The introduction of OxyContin in 1996, manufactured by Purdue Pharma, is often cited as a key factor in the crisis. The company's aggressive marketing tactics, which included targeting primary care doctors with limited education on pain management, helped to drive up sales of the drug. As a result, opioid prescriptions skyrocketed, with over 300 million prescriptions written by 2016. Data shows that the number of opioid prescriptions increased dramatically during this period, with devastating consequences. Nicole Saphier notes that the government's response to the crisis was slow and inadequate. The Joint Commission's introduction of pain as the fifth vital sign in 2001 which required doctors to ask patients about their pain levels, led to even more opioid prescriptions being written. The Centers for Medicare and Medicaid Services' emphasis on patient satisfaction surveys also created an environment in which doctors felt pressure to prescribe opioids to manage pain. The data highlights the significant increase in opioid-related deaths and hospitalizations during this period. The consequences of the opioid crisis have been severe, with an estimated 50 million Americans living with chronic pain and over 2 million struggling with opioid addiction. Nicole Saphier argues that the crisis is not just a matter of personal responsibility, but also of government and corporate accountability. The fact that pharmaceutical companies knowingly downplayed the risks of addiction and targeted vulnerable populations, including the elderly and those with mental health conditions, is a clear example of bad behavior. Furthermore, the government's failure to regulate the pharmaceutical industry and its reluctance to fund addiction treatment programs have exacerbated the crisis. The lack of access to affordable healthcare and addiction treatment services has meant that many Americans have been forced to rely on illicit opioids, such as heroin and fentanyl, which are often laced with deadly substances. Nicole Saphier emphasizes that the crisis requires a comprehensive solution that involves not only reducing the supply of opioids, but also addressing the root causes of addiction, including poverty, lack of education, and mental health issues. The financial costs of the crisis are staggering, with an estimated $1 trillion spent on healthcare, law enforcement, and lost productivity. Nicole Saphier argues that this could have been avoided if the government and pharmaceutical companies had taken a more responsible approach to opioid prescribing and marketing. Instead, the crisis has been allowed to spiral out of control, with devastating consequences for individuals, families, and communities. In conclusion, the opioid crisis in America is a complex issue that requires a multifaceted solution. Nicole Saphier's analysis highlights the need for greater government regulation, increased funding for addiction treatment, and a shift in cultural attitudes towards pain management. By understanding the root causes of the crisis and taking a comprehensive approach to addressing them, it may be possible to reduce the devastating impact of opioids and create a safer, healthier future for Americans. Chapter 7, the Affordable Care Act. Nicole Saphier emphasizes that the root cause of the trillion-dollar healthcare crisis in America lies in bad behavior and government intervention. The Affordable Care Act, also known as Obamacare, was meant to provide health insurance to millions of Americans, but it has been criticized for its flaws and unintended consequences. According to Nicole Saphier, the ACA has led to increased costs, higher deductibles, and limited choices for consumers. For instance, data shows that employees' total financial responsibility, including premiums, deductibles, and copays, increased by 54% from 2006 to 2016, while wages only increased by 29% during the same period. Nicole Saphier argues that the ACA's pre-existing condition policy does not distinguish between preventable and unavoidable diseases. This means that individuals who engage in unhealthy behaviors, such as smoking or overeating, are not held accountable for their actions, and instead, the costs are shifted to others. As a result, the system is incentivizing bad behavior rather than promoting healthy habits. For example, cardiovascular disease and stroke account for nearly 20% of all health expenditures, with approximately 80% of deaths from these diseases attributed to preventable factors such as obesity, low physical activity, and poor diet. The government's expansion of Medicaid has also been criticized for its lack of sustainability. Nicole Saphier notes that the program has led to an increase in healthcare utilization, but has not addressed the underlying issues of bad behavior and lack of personal responsibility. In fact, the program has created a culture of dependency, where individuals rely on government assistance rather than taking charge of their own health. The data shows that the majority of medical costs are due to chronic diseases, and half of them are preventable. This suggests that individual choices, rather than government intervention, are the key to reducing healthcare costs. Furthermore, Nicole Saphier argues that the ACA's emphasis on access to care, rather than comprehensive health insurance, has led to a system where individuals are not incentivized to make healthy choices. The use of high-risk pools and block grants to states could be an alternative approach, where individuals with pre-existing conditions are guaranteed funding, and the healthy are not penalized with higher premiums. This approach would promote personal responsibility and reduce the financial burden on the system. In addition, the pharmaceutical industry has been criticized for its role in the healthcare crisis. Nicole Saphier notes that the high cost of prescription drugs is a serious problem, but it is not solely the fault of the pharmaceutical companies. The system is complex, and there are many factors at play, including the role of pharmacy benefit managers and the lack of transparency in drug pricing. However, it is also important to recognize that investments in science and innovation are critical to developing life-saving treatments, and that price controls and government intervention may not be the solution. Overall, Nicole Saphier's analysis suggests that the trillion-dollar healthcare crisis in America is a result of a combination of bad behavior and government intervention. The ACA's flaws and unintended consequences have led to increased costs, higher deductibles, and limited choices for consumers. To address the crisis, it is essential to promote personal responsibility, incentivize healthy behaviors, and address the underlying issues of bad behavior and lack of accountability. By doing so, America can reduce healthcare costs and create a more sustainable system that prioritizes individual choices and freedom. According to data, the total cost of healthcare in the United States is $3.3 trillion, with a significant portion of it attributed to preventable diseases. By focusing on individual choices and promoting healthy behaviors, Americans can reduce the cost of healthcare and create a more sustainable system. Chapter 8: The Medical Doctor. The medical profession in America is facing a crisis, and Nicole Saphier delves into the intricacies of this issue. The erosion of respect for doctors, the depersonalization of medicine, and the exploitation by the American Medical Association, AMA, have all contributed to this predicament. According to data, the number of doctors per capita in the United States is lower compared to other countries, exacerbating the problem. Nicole Saphier explains that the AMA, which was initially formed to promote the interests of physicians, has become a self-serving organization that prioritizes profits over the well-being of doctors. As data shows, the AMA's revenue has increased significantly, with $72 million in revenues from royalties of its products in 2010, twice as much as it took in for membership dues that year. This shift has led to the exploitation of physicians, who are now seen as mere commodities rather than respected professionals. The pressure to increase patient loads and reduce costs has resulted in decreased job satisfaction and increased burnout among doctors. The government's role in this crisis cannot be overstated. Nicole Saphier argues that the government's emphasis on cost-cutting measures, such as the Affordable Care Act, has led to a significant increase in administrative tasks for physicians, taking away from the time they can devote to patient care. According to data, the average length of a visit with a primary care doctor ranges from 8 to 18 minutes, which is not enough time to discuss topics such as medication reviews and potential preventative care. The constant need to justify treatments and procedures to insurance companies has created a culture of defensive medicine, where doctors are more focused on avoiding lawsuits than providing quality care. The impact of this crisis is far-reaching, with doctor shortages, decreased job satisfaction, and increased burnout among physicians. Nicole Saphier notes that the lack of autonomy and respect for doctors has led to a decline in the number of students applying to medical school, with many instead opting for careers in hospital administration or the pharmaceutical industry. Furthermore, nurses are also experiencing burnout, with almost half of those surveyed considering leaving their field. The data highlights that the number of physicians in the United States is decreasing, which will have severe consequences for patient care. The AMA's role in this crisis is multifaceted. Nicole Saphier explains that the organization's creation of the CPT codebook, which is used for billing and insurance purposes, has led to a system that prioritizes profits over patient care. The complexity of the coding system has resulted in a lack of transparency in medical billing, with procedures and diagnoses being replaced with numeric codes. This has created a system where doctors are incentivized to prioritize billing and coding over patient care. As data shows, the AMA's actions have led to a significant decrease in the number of physicians who are members of the organization, with only 15 to 20% of practicing physicians being members. The government's emphasis on cost-cutting measures has also led to the rise of surprise billing, where patients are charged exorbitant fees for out-of-network care. Nicole Saphier argues that this practice is unfair and has led to a lack of trust between doctors and patients. The data highlights that patients are often left with large bills and are forced to navigate the complex healthcare system to resolve these issues. The lack of transparency and accountability in the healthcare system has created a culture of mistrust, where patients are pitted against doctors and insurance companies. In conclusion, Nicole Saphier's analysis of the crisis in the medical profession highlights the complex interplay between government policies, the AMA's actions, and the resulting burnout and dissatisfaction among physicians. The data and examples provided demonstrate the severity of the issue and the need for urgent reform. Unless there is a shift in priorities to bring autonomy and satisfaction back to physicians, the crisis will continue to worsen, leaving vulnerable patients without access to adequate care. Chapter 9, With Freedom Comes Responsibility. Nicole Saphier argues that the current healthcare system in the United States is ineffective and costly, with a significant portion of the expenses being attributed to preventable diseases and unhealthy behaviors. According to data, nearly 900,000 Americans die prematurely each year due to factors that could have been altered, with cigarette smoking alone claiming 1,300 lives daily. This staggering number of preventable deaths is a clear indication that the system is failing to promote healthy choices and hold individuals accountable for their actions. The problem is further exacerbated by the fact that the healthy and the unlucky are often grouped together, with the healthy subsidizing the costs of the unhealthy. Nicole Saphier suggests that this is akin to a single-payer system without actually having one, where the lucky and the unhealthy are combined, and the healthy are left to foot the bill. The current system, built on free market competition, has led to some of the most innovative treatments and diagnostic capabilities. But it also means that the healthy are paying higher premiums for insurance coverage they may never utilize. Nicole Saphier points out that the Emergency Medical Treatment and Labor Act of 1986 requires hospitals to provide emergency services regardless of ability to pay, leading to significant costs being shifted to hospitals, emergency department doctors, and taxpayers. This, combined with the overuse of emergency departments for non-emergencies, results in a significant financial burden on the system. For instance, data shows that roughly 71% of emergency department visits could have been treated adequately in an urgent care center or primary care doctor's office. The overuse of antibiotics is another concern, leading to the development of antibiotic-resistant superbugs and increased healthcare costs. According to data, the average patient facing an antibiotic-resistant infection could expect a medical bill of between $18,000 and $29,000, totaling $20 billion in costs each year. Hospital-acquired infections also contribute to the problem, with the CDC estimating that the overall annual direct medical costs of healthcare-associated infections range from $20 to $35 billion. Frivolous lawsuits and the fear of malpractice suits also drive up healthcare costs, with the United States having more malpractice lawsuits than anywhere else in the world. This leads to defensive medicine, where doctors order unnecessary tests and procedures to avoid potential lawsuits, further increasing costs. Nicole Saphier argues that the current system is reactive, focusing on treating illnesses rather than preventing them, and that a new sense of responsibility for poor lifestyle choices is needed to improve overall health and decrease healthcare costs. The Affordable Care Act has also created a demand for care, but it has not done enough to address the root causes of healthcare costs. Instead, it has led to lengthy wait times and increased costs, with the middle class paying for expensive plans they may not need. Nicole Saphier suggests that the system should be reformed to simplify payment structures and reduce preventable diseases, rather than relying on a single-payer system that could lead to rationing and reduced access to care. The Medicare system is also problematic, with older Americans receiving expensive care over the course of longer lives, and doctors and hospitals being reimbursed at lower rates for Medicare patients. This leads to a situation where privately insured patients are helping to offset the losses from Medicare patients. Nicole Saphier argues that the Medicare system is financially stressed, and that the idea of Medicare for all is unsustainable without significant reforms to reduce healthcare costs. Nicole Saphier also looks at the experiences of other countries, such as Canada and the United Kingdom, which have single-payer systems. While these systems may provide universal coverage, they often come with high taxes, long wait times, and rationing of care. For example, in the UK, the NHS has begun restricting surgeries and rationing care for patients who are obese or smoke, and has even told patients they have a responsibility not to request surgery that does no good. Nicole Saphier argues that such a system would be difficult for Americans to accept, and that the U.S. should instead focus on reforming its own system to promote healthy behaviors and reduce preventable diseases. Ultimately, Nicole Saphier believes that the solution to the healthcare crisis lies in a strong privatized health industry intertwined with equally robust government health services, but with a focus on eliminating inefficiencies and promoting healthy behaviors. By lessening demand and reducing preventable illnesses, the U.S. can lower healthcare costs and preserve quality and access to care. This can be achieved by addressing the root causes of healthcare costs, such as unhealthy behaviors and the overuse of emergency departments, and by promoting a culture of responsibility and accountability in the healthcare system. Chapter 10: The American Health System. The privatization of America's health system has been a gradual process, and understanding its evolution is crucial to addressing the current crisis. As Nicole Saphier explains, the early 20th century saw a significant shift in healthcare, with the introduction of new technologies and treatments leading to increased costs. However, the concept of preventative care and long-term disease management was not yet fully developed. The introduction of private health insurance, such as Blue Cross Blue Shield, marked a significant turning point in the history of American healthcare. Initially, the goal was to provide affordable access to healthcare, but over time, the system has become complex and driven by profit. According to Nicole Saphier, the turning point came with the passage of the National Labor Relations Act in 1935, which led to the growth of private health insurance. The act allowed employers to offer discounted health insurance plans to employees, making healthcare more accessible to the working population. By World War II, the health insurance industry had expanded, with multiple companies offering various plans and government incentives. However, this growth also led to rising healthcare costs, which have continued to increase over the years. Nicole Saphier argues that the Affordable Care Act, ACA, has contributed to the current crisis by creating a sense of entitlement regarding insurance coverage and care, regardless of health status. The ACA's provision for pre-existing conditions, while well-intentioned, has led to higher premiums and deductibles for everyone. The concept of insurance has lost its meaning, as people can now purchase insurance after they become sick, rather than before. This has resulted in a system where healthy individuals are subsidizing the costs of those who are sick, leading to a trillion-dollar crisis. The data shows that the ACA has not been effective in controlling costs, and in fact, has led to increased healthcare spending. For example, the average deductible for self-coverage, has risen from $6,600 in 2015 to $7,900 in 2019. This has resulted in higher out-of-pocket costs for individuals, even if they do not require medical care. Nicole Saphier suggests that cost sharing is a crucial component of any healthcare system, as it helps to prevent overutilization of healthcare services and encourages individuals to make financially sound decisions. The ACA's emphasis on value-based care has also been criticized by Nicole Saphier, who argues that it has led to excessive regulation and administrative burdens on healthcare providers. The focus on bundled payments, value-based reimbursements, and electronic medical records has taken away from the core mission of delivering patient care. Instead, healthcare providers are now focused on meeting regulatory requirements and clicking boxes on EMRs, rather than providing high-quality care to patients. Nicole Saphier proposes that a system that rewards healthy behavior and penalizes unhealthy behavior could be a more effective way to control costs. For example, insurance companies could offer lower premiums for individuals who maintain a healthy weight, exercise regularly, and do not smoke. Conversely, individuals who engage in unhealthy behaviors, such as smoking or poor diet, could face higher premiums or cost sharing. This approach would provide a tangible incentive for individuals to make healthy choices and take responsibility for their own health. The data suggests that this approach could be effective, as studies have shown that workplace wellness programs that offer financial incentives for healthy behavior can lead to significant improvements in health outcomes. For example, a study published in the Journal of Occupational and Environmental Medicine found that employees who participated in a wellness program that offered financial incentives for healthy behavior had lower blood pressure and body mass index compared to those who did not participate. In conclusion, Nicole Saphier's analysis suggests that the current healthcare crisis in America is a result of a combination of factors, including bad behavior and government policies. The emphasis on profit over patient care, the lack of personal responsibility, and the failure to address the root causes of chronic diseases have all contributed to a system that is unsustainable and inequitable. By understanding the history of the American healthcare system and the factors that have led to the current crisis, it is possible to identify potential solutions, such as cost sharing, value-based care, and incentives for healthy behavior, that could help to control costs and improve health outcomes. Chapter 11: Personal Responsibility. Nicole Saphier highlights the importance of individual health and the need for America to maintain its leadership in medical innovation, with a healthcare system that is fiscally sustainable and a population that is not burdened by preventable illness. The current medical system is more focused on treating illnesses rather than preventing them, with Americans often waiting until they get sick before seeking treatment. This reactive approach has led to outrageous costs and a healthcare system on the brink of collapse. The rising obesity rates in America are a significant contributor to the healthcare crisis, with the average weight of an American adult increasing dramatically since 1980. Nicole Saphier cites the entry of women into the workforce as one of the factors contributing to this rise, as it has led to a decrease in home-cooked meals and an increased reliance on processed and packaged foods. The proliferation of fast food and a decline in physical activity have also played a significant role in the growing obesity problem. The data shows that 60 to 75% of Americans are overweight or obese, with this number continuing to increase. The normalization of being overweight has led to a market that caters to this demographic, with plus-sized clothing and big and tall stores becoming increasingly common. However, this acceptance of obesity has severe consequences, with obesity-related illnesses costing Americans approximately $150 billion every year. Nicole Saphier notes that this is twice as much as is spent on veterans' benefits, and roughly 4 times what is spent on foreign aid. The data indicates that an obese person's medical costs are $1,429 higher than a person with a normal weight, highlighting the significant financial burden of obesity. The prevalence of fad diets and quick fixes has not helped to alleviate the obesity problem, with many of these diets being unsustainable and leading to a regain of lost weight. Nicole Saphier argues that there is no magic pill or government program that can provide a quick fix, and that individual effort and lifestyle changes are necessary to achieve long-term success. The data shows that 80% of Americans do not eat according to the recommended diet, with excessive calorie intake and a lack of physical activity contributing to the growing healthcare crisis. The consumption of sugary drinks and alcohol is also a significant contributor to the healthcare crisis, with the data showing that half of Americans drink an average of 2 to 3 sodas per day. Nicole Saphier notes that drinking sugar is as bad for health as smoking cigarettes, and that the costs of excessive alcohol consumption are substantial, with Americans spending $249 billion a year on related health problems. The data indicates that alcohol consumption can lead to certain cancers, obesity, and other health problems, highlighting the need for individuals to make lifestyle changes to reduce their risk of developing these conditions. Nicole Saphier also highlights the issue of smoking, which remains a significant public health problem despite the known risks. The data shows that smoking costs the nation over $300 billion a year, with secondhand smoke killing 42,000 people per year. The rise of vaping has also been identified as a concern, with cases of lung damage and death already being reported. The data indicates that vaping is not a healthy alternative to smoking, and that individuals should be aware of the risks associated with this behavior. The acceptance of marijuana use has also been identified as a concern, with Nicole Saphier noting that while it may have some medicinal benefits, recreational use has little benefit and the potential for harm. The data shows that marijuana use can exacerbate existing breathing problems, lead to heart disease, and increase the risk of psychosis. The data also indicates that teenagers and young adults who smoke regularly may have lower IQs, which can have long-term consequences for their health and well-being. Nicole Saphier argues that the government's approach to addressing these health issues has been ineffective, with taxation and regulation being used as a means of controlling behavior. However, this approach has not led to significant changes in behavior, and has instead led to a culture of dependency on government intervention. The data shows that taxation is not an effective deterrent, and that individuals are willing to pay extra for products that are bad for their health. Nicole Saphier suggests that a more effective approach would be to require individuals to pay more for health insurance or doctor visits if they engage in high-risk behaviors, rather than relying on taxation as a means of control. The issue of vaccination has also been identified as a concern, with Nicole Saphier noting that the HPV vaccine has the potential to prevent thousands of cases of cancer each year. However, the data shows that many people are not getting vaccinated due to concerns about adverse side effects or a lack of awareness about the risks of the virus. Nicole Saphier argues that this is a selfish and negligent decision, as it not only puts the individual at risk, but also their sexual partners. The data indicates that the HPV virus is a common sexually transmitted virus, with an estimated 80% of sexually active people contracting it at some point in their lives. Overall, Nicole Saphier argues that the healthcare crisis in America is a result of a combination of bad behavior and ineffective government policies. The data shows that individual lifestyle changes, such as a healthy diet and regular exercise, are necessary to reduce the risk of developing chronic diseases. However, the government also has a role to play in addressing these issues through education and awareness campaigns, as well as policies that promote healthy behavior. By working together, it is possible to create a healthier America, where individuals are empowered to make choices that promote their health and well-being.
Hit that like button and don't forget to subscribe.